If we look about the tonsils, we can see that we have erythemus and the tonsils, they are swollen. And cervical nodes, they are also swollen and tender. Okay. Give me now your scoring for it. Did I mention about the fever or body temperature? Which means that it is usually below 38. Okay? Which means that we give him a 0. Okay? This absence of cough, we do it, and the age, we give it 0. Now you can see it, we got a score of 3. What we are supposed to do right now? We said if we got the score 2 or 3, we need to do rapid antigen detecting test. That's the one we said it is very simple. Okay? And a child who is below 15, if it is the result negative, we need to do culture before we going to manage with antibiotics. Please, this is the major concept of this lecture, just to let you know where we are supposed to use antibiotics, where it's not. Okay. Case 7 now, 25-year-old, sore throat, chills, fever, pain and swelling, denies cough, runny nose. Okay, temperature, it is 38.5. Everything else is okay. Everything is okay. However, you can see that we have some exudate on the tonsils. Again, it is just 3. The score, it is just 3. حفظتوها للدور? Okay. Okay. So let me now. So here is the ideal approach for a child, or if you have an adult whatsoever, okay? First of all, you have sore throat. What you will do after you scoring, you will see it is a 0 or 1, stop here, okay? If it is 2 or 3, then go ahead and do for him the rapid antigen test, okay? If it is positive, you go and treat with antibiotics. If it is negative, we need to confirm it with a culture before we go into the antibiotics. Okay, now how we are going to manage? We have a sore throat, okay, different cases whatsoever. How we are going to manage it? Symptomatic treatment for everybody, okay? Just like we give adequate fluid, as you already know. Warm gargles يعني الغرغرة okay, مي وملح, gargles, and we give him something just like to suck on it. يمصه. We prefer the thing that does not contain any other ingredient. No mannitol, nothing, okay, no menthol whatsoever. Just go with the honey and lemon. العسل والليمون فقط. No other, all the other ingredients you will find it in the pharmacy, almost they are useless. Okay? Just go with that. And if you are unable to find something like this, go with something very cheap. Just let him suck on hard candy. Suck يمص على سكر. أعطيه حبوب سكر ولا أي سكر يمص عليه. That will increase the production of saliva, and that will be coating now the irritated area. Okay? And whenever we have an increase in the body temperature and some kind of painful issues, that we give some analgesic antibiotic. Okay. All the preparation, I just will mention something now. Again, unfortunately, all the preparation, yes, you'll find it in the pharmacy. They're containing different ingredients. Many of them. It's actually, again, unfortunately, it's not been proven by any clinical studies that they have any advantage. Just go and use a single ingredient for what the patient is suffering. He's suffering from pain, increased body temperature, just give him a acetaminophen or paracetamol. Okay, that's it. That's it. You don't need to go into this. And now, if it is if it is a virus, if it is a bacterial, then you're adding now antibiotics. And here just will give you the antibiotics that it's supposed to be used. We have this, the first choice. We're using penicillin V. All of them, again, that's misconcept or mispractice that they might be using it for a few days. موجودة بالمستوصفات بتعرفوا بيعطوا شوية حبوب هيك اليوم يومين 2 or 3 days, okay, and it is useless. It is useless. So you need to give it for 10 days. complete the course for 10 days. Except few of them, I just will give you how much you are able to use, for how many days, for how long. So the first drug of choice, we give penicillin V orally. We give penicillin V orally. It might be given twice to 3 times per day, okay? And again for 10 days. In pediatric population, we prefer to go with amoxicillin because we have more experience with amoxicillin. So in pediatric population, we go with amoxicillin. Amoxicillin, you can see it here, and we are able to give it as a single dose. So it is very good for those patients who are aggressive. عندكم بعض المرضى صعب كثير تعطيه الدواء, okay? So he's not complying with you. There is no compliance. So here we prefer to give a amoxicillin because you are able to give it as a one dose, okay? Now, if your patient is negligent, يعني مهمل, he is unable to take his medication and so on, here you are able to give benzathine penicillin injection just like once. If the body weight below 27 kilogram, we give 600,000 units, and if it is a body weight that is above 27 kilogram, we give a 1.2 million unit of penicillin, okay? This is a treatment for those individuals that they don't have an allergy to penicillin. If they have an allergy to the penicillin, we might be giving some of the, usually they say we have specific treatment or specific drugs related to cephalosporins or cephalosporins, level 2 or 3. نسينا شو بنسميه. Generation. Okay. So we give it just like A4. Second and third generation of cephalosporins, they don't have actually some cross-allergic reactivity with penicillin. Some of the compounds of cephalosporins, they don't have a allergic with a penicillin. Okay? Then you can see it here. We go with some of these cephalosporins. However, we might be using clindamycin, okay? And we might be using azithromycin in adult, those who are above, the FDA had been approved azithromycin in the adult who are above 16 years old, and clarithromycin, we are able to use it in small children in that case, okay? Now you can see among them, the only ones that here who are able to use it, all of them were supposed to use it for 10 days, okay? Except azithromycin, we are able to use it for 5 days. We are able to use it for 5 days. So here we mention about penicillin. I need to mention something about the penicillin. It is cheaper than amoxicillin. Definitely have a narrow spectrum of activity. So you just taken out the bacteria that you need. However, you can see it here. If you give it once daily, it is not effective. If you give it once daily, it is not effective. Any of these medication, penicillin V or amoxicillin, if you give it for 5 days, you increase the dose, you give it for 5 days, or you increase the dose, you give it for 7 days, whatsoever, it is not effective. Clear this point? So you will go for 10 days exactly. You will go for 10 days exactly. Okay. So you have a failure rate actually if you give it for 7 days or 5 days, no matter how much you are going to increase the dose. Okay. Then if the patient, we said that it is allergic to penicillin, we can give some of the macrolides like erythromycin or azithromycin, we said, or we have erythromycin, as I mentioned. Okay. Now, what it might be if you give a full course and your patient now have been not responding, you have a failure. You have a failure, okay? We have many causes for the failure. Just like one thing that you need to pay attention for it, it may be a reinfection. Reinfection from the toothbrush. من فرشاة الأسنان. Still now the bacteria is still there, he's using it again, so it will be just like reinfect himself again and again. So what you are supposed to do then, just like to change the toothbrush. If your patient is just like have a recurrence. Now let me show you what you are supposed to do if you have your patient have a recurrence. He have 3 attack within about 3 months. اجته 3 هجمات خلال 3 أشهر. Okay, what you are supposed to use here? You go and use clindamycin. You go and use clindamycin, as you can see, again it is for 10 days. Or if you don't want to use clindamycin, here we use a combination of amoxicillin and clavulanic acid. Don't just jump from the beginning to augmentin. هذه كمان just like a common mistake that in the practice. That just will be jumping directly to augmentin. Augmentin is a combination of amoxicillin and clavulanic acid. Don't jump to it. We just like use it for the recurrent infection. Okay? And in some cases, the same for the recurrent infection. We can give now benzathine penicillin G 1 injection, as I said previously, and we combine it with rifampicin or rifampicin, the same name, right? Rifampicin or rifampicin. We just like combine it. We just give an injection for rifampicin or rifampicin. We give it for 4 days. And that's a course for the recurrent infection. Okay. So I'm just trying to get it faster so you'll be able to know it. Okay, how you can prevent all of that stuff from the beginning, okay? Keep your area in the humidity, okay? And again, we said that, for an example, الكف or sneezing, هذه غلطة كبيرة. I mean, everyone is doing it, right? Just we sneeze, we catch it in our hand, then alhamdulillah, we just like, okay? And then whenever we hug anyone and so on, just like we transfer for him the bacteria whatsoever, the viruses and so on. So if you are unable to put it in your soft tissue, dispose it. If not, then the best way, just like whenever you want to sneeze, just like put it in your elbow. Okay? This is the best way if you are unable to do some other things. Again, you can see it here. We don't share anything with the other without cleaning it. Probably one of the major cause for transferring of that, specifically those people who are using the library, sharing the computer, okay? The mouse, the keyboard, everything that it will be contaminated. So you need just like to be careful about these issues. Okay, I already mentioned that somehow. Let me just move a little bit. Okay, now this patient, what do you have? Just look about him and see. Do you have tonsillitis? Yes or no? Yes. Okay. Very good. I just will put for you many pictures so you'll be able to see it. You'll be able to see it. Okay. Now, case number 8. Case number 8. We have 20-year-old, okay, woman, have severe sore throat, difficulty swallowing, no cough. Okay. The neck also hurts. عندها مشكلة هون فيها temperature 39.5. Okay. And we have an anterior cervical adenopathy, both sides, left and right. However, you can see it. It is difficult for her to open her mouth from the pain. And there is some drooling. شو drooling؟ ما بتقدر تبلع حتى اللعاب تبعها. عم بيتشرشر فيها. What is your diagnosis now? With that kind of picture, with this kind of picture, it is actually we call it a quinsy abscess, or we call it البريتونسيلر abscess. هذا صار معناته عندها خراج حول اللوزة. And that will be irritating nerve number 5. Okay, so we have transmission. بصير عندها ضزز بنسميه في اللغة العربية. Okay? شفت على أسنانها هيك cannot open it. You cannot open it. So it is a serious it is a serious case. So we have a salivation because of stimulation of this nerve, salivation and الرسمس الضزز اللي سميناها هذا الشيء. And we have a specific voice. We call it the hot potato voice. حدا بيعرف شو هذا الهوت بوتيتو voice؟ كأنك حاطط تتذكر إذا واحد حط بيتمه لقمة سخنة هيك بطاطا سخنة عم بيحكي حدا سأله كيف بيحكي؟ That's what we call it. Okay? That's what we call it the hot potato voice. It is a clinical indication or a clinical signs for that you have a quincy or you have a what we call it an abscess, okay? An abscess beside the peritonsillar abscess, I just put for you many of them, so don't forget about it. Some of it is in the right, some of it is in the left, okay? Where is that now? In the left or in the right?
The right.
In the left. Oh, okay. Now, this one, where it is? In the left also, okay? Again, just whenever you examine the patient, look about the uvula, اللهات. It will be deviated by the opposite side, where you do have the abscess, okay? This one, in the left, okay. How we are going to treat it? كيف بنعالجه? The standard therapy for it is just like, that's the reason I said don't give now, just like for anyone who is feeling, some pain and so on, just go ahead and just treat him with antibiotic. That it need to be incision, and we just like drain all the pus. And then we give the antibiotics. Usually we need to give the antibiotics as an IV. Okay? Okay. الآن فرجيكم بعض الحالات. We still have 5 minutes or more. Yes. Okay. So I just will show you now some of the cases that also you have sore throat, the main complaint, the major complaint sore throat, but you need to put a definitive diagnosis and you treat it differently. Okay, now look about this one. 8-year-old boy have a fever, sore throat, difficulty swelling, and so on. Now we examine him. Look what we found. What's your diagnosis on this? We have figured out that we have a pseudomembrane. Pseudomembrane, it is gray in color. وجدنا غشاء كاذب مغطي المنطقة. It is well demarcated, محدد بشكل جيد, واضح for you. Okay? And it may be the patient have a bull neck, عنقه متضخم. What you will give diagnosis? This is the diphtheria. This is the diphtheria. Okay? This is the diphtheria. You can see it here. البول نيك شوفوا كيف هذه. Usually have conjunctivitis. التنتين عيونهم محمرين. And that's diphtheria. How you are going to treat diphtheria? We give diphtheria antitoxin. We're supposed to give it inside the intensive care unit. The FDA did not approve it for the treatment. It's very dangerous. They produce it in the horses, okay? So you need to make a test and so on. So just like we give it usually, whenever you decide the dose, you will give it an IV infusion, okay, for about 4-6 hours, and you give it penicillin or erythromycin for 2 weeks. Case number 10. 6-year-old girl, sore throat, okay, no cough, no vomiting, no diarrhea, allergic to penicillin, temperature 38.2, okay. The tonsils we have buffy tonsils بالضخمين, almost they are blocking the area, okay. They are meeting on the midline, and enlarged tender anterior cervical nodes. She has a rash. We call it sandpaper rash. I will show it to you. شو معنات الساندبيبر rash؟ احنا دول محاضرات عاملينهم اللي صاروا باخر السنوات تقريبا يعني. What we mean by sandpaper rash? It is a rash مثل ورق الازاز. شفت ورق الازاز؟ Okay? How you touch it, you feel it. Okay? That's exactly now the rash. Okay. What that will give you an idea of what? The same, very similar case. The mother said that he has a white tongue. Next day he has a strawberry tongue. لونه صار أحمر. What you will have now?